Assalamu alaikum. Today we will study about the reactions of drug metabolism, that is biotransformation of the drug, phase 1 and phase 2 reactions. Now, since the drug is lipophilic, it goes through the phase 1, oxidation, reduction or hydrolysis, any of the reactions to make this polar. Following phase 1, the drug may be activated, unchanged or most often inactivated. It can be any of these forms depending on the drug chemical nature. Then it may go phase 2 reaction. Some drugs directly enter phase 2 while some go through phase 1 and then enter phase 2. Phase 2 where the drug is conjugated and usually it is inactivated. These are water soluble drugs and eliminate. Now phase 1 reaction convert lipophilic into more polar molecules. You have to remember this. Polar functions are hydroxyl group, amine group. Phase 1 reactions are utilizing P450 system. CYP is a superfamily of heme containing isozymes primarily in the liver and GIT. You just have to remember CYP 450. The family name is indicated by Arabic number that follows CYP and the capital letter designates. Okay, this was the nomenclature. Now you have to remember this table. These are the cytochrome P450 isoforms. Now specificity, because there are many genes to encode, these are all specific. 4 isozymes, CYP3A 4/5, CYP2D6, CYP2C8/9. All of these are the P450 catalyzed reactions. Now genetic variability, many factors depends on this, and the drug gets converted either into a active form or inactive form. There are some known as poor metabolizers. For example, clopidogrel. It always carries a warning for those patients who are poor metabolizers of CYP2C19. They will have a diminished antiplatelet effect when taking this drug. Because this is a prodrug, it needs to be converted by this enzyme. If this enzyme is absent, it will not be converted in an active metabolite and the patient will see diminished effect. CYP inducers. Some drugs are inducers, some drugs are enzyme inhibitors. Phenobarbital, rifampin, carbamazepine, these all are CYP inducers. These will induce the enzymes and hence lead to significant decrease in the plasma concentration of the drugs, because when the enzymes are induced, it means the drug will be metabolized more and it will be eliminated soon. Now, common inducers, you have to remember carbamazepine, phenobarbital and rifampin. Inducer and the substrates are celecoxib, glimepiride, ibuprofen, phenytoin, warfarin. For CYP2C19, CYP2D6, common are fluoxetine, haloperidol, paroxetine, propranolol. Now CYP inhibitors. Inhibition of the drug metabolism leads to significant increase in the plasma drug concentration. When the plasma drug concentration is increased, the enzymes are inhibited, it is not metabolized, it means it will lead to toxicity. Phase 1 reactions does not involve the P450 system. These include amine oxidation, esterases, hydrolysis. Phase 2 consists of conjugation reactions. If the metabolite from the phase 1 is sufficiently polar, it will be excreted. Otherwise, it will go under the conjugation and become polar and eliminate. This now drug is cleared by either kidney. Glomerular filtration we will study more deeply in diuretics. This is a basic diagram. It is a Bowman's capsule. Free drug enters here. Active secretion of drug is through proximal tubule and then loop of Henle, distal tubule, collecting drug. This is the passive reabsorption of the drug, which is lipid soluble. Now this was the completion for our pharmacokinetics, and then we will have some case studies.